Alright, guys, welcome in today. We're going to be talking about chest, abdominal, and pelvic injuries. So, the first thing we're going to talk about is chest injuries. The first classification we're going to use is talking about open or closed chest injuries. So, the only difference between the two is the same as any wound. So, an open wound is a wound that's broken the skin, whereas a closed wound is a wound that has not broken the skin. So, the same goes with chest injuries. If we've broken the skin over the chest, then it's an open chest wound. If we've not broken skin, then it's a closed chest wound. Anybody that has a chest injury or that you suspect has a chest injury, you need to check their airway, breathing, and their circulation. You need to check it and you need to recheck it. Those are very important because of the major organs that are found in your chest, your heart, your lungs, etc. Anytime you have a responsive person, you should sit them up or you should place them with the injured side down. Now, the reason you do that is to prevent any blood from leaking to the other side of the chest. Anytime you have fluid filling up in the chest of any sort, or any foreign body, be it fluid or even air that's not supposed to be there in the chest cavity, that is dangerous and can lead to collapsed lungs and other things like that. So, if they're responsive, sitting up or injured side down. So, first we're going to talk about closed chest injuries. I thought this was a appropriate picture. So, for rib fractures, first we're going to talk a little bit about rib anatomy so that you can help identify these different rib fractures a little bit better and how to treat them. So this is a quiz question. Make sure you understand which ribs are which and what they're identified as, because it'll be on the quiz. So the four upper ribs are really heavily protected by muscles, your collarbone and your shoulder blades. So your chest muscles, your pecs, your collarbone, and your shoulder blades on your back help protect those ribs quite a bit. The two bottom ribs are called floating ribs, and they have a lot more freedom to move. So if you look at this picture over here, this is from the back, looking at the spine. These two ribs right here, if you'll notice, they don't actually connect in the front. All of your other ribs connect to cartilage that connects to your sternum. Okay, so those two are not connected at all. The other thing you need to be aware of is so these other ribs above your bottom two ribs, okay, are considered your true and false ribs. True ribs meaning they come around and directly connect with just a little bit of cartilage, right? Whereas your false ribs, 8 through 12 right here, they don't all have an individual connection to the sternum. They have a joint connection through cartilage to the sternum. So that's how it is shown. Okay. All right. And most broken ribs are going to occur on the side of your chest, out here in your ribs, not in the front. Okay. These would not be considered fractures of the rib because it's the cartilage. Most of the fractures themselves can really only happen on the bone themselves out here on the side. So as far as what to look for with rib fractures, the biggest thing we're concerned about is the type of pain they're experiencing. So most rib fractures, they will feel a very, very sharp pain anytime they take a deep breath or they cough or they move, just because those ribs move a lot with all of those instances. They will also have some muscle guarding, meaning the muscles around the possible rib fracture are going to tighten up to help protect it. They may have to breathe very, very shallow to avoid pain. They're probably also going to have some bruising or some discoloration in the area. Now, this is a question, so make sure you understand these as well. Quickly, before I move on, I did want to mention really quick, rib fractures can be pretty hard to differentiate from other chest injuries, meaning if there's just like a cartilage injury, there's a lot of musculature and ligaments in between all your ribs that help hold them in place that can be injured. So the biggest thing is being able to know where the ribs are at, being able to palpate the area and decide, is it right on the rib? Is it not on the rib? Is it in between the ribs? Does the rib move when I push on it? Those are the types of things you need to be able to watch for to be able to differentiate between an actual rib fracture or not a rib fracture. Rib fracture, well, we're going to talk about this on the next slide, but if it's not an actual rib fracture, it's not going to require a referral to a physician or to another medical provider or advanced medical care. That's really just going to have to heal on its own. But a rib fracture you are going to need to refer for, which we'll talk about on the next slide. So, as far as if you determine somebody has a rib fracture, you're going to help the person find a comfortable position. You're going to try and stabilize their chest the best way that you can. The way you can do that is you can give them a blanket or a pillow that they can either hold on to or that you can wrap on to hold in place to help stabilize the area. Give them some over-the-counter pain medication. Try and have them take deep and slow breaths. So that if they're trying to breathe too hard, it's going to cause a lot of pain. So try and be very slow and controlled with their breath movements, and then you're going to call 911. The biggest problem with a rib fracture is the chance of the dislodged rib, especially if it's dislodged or displaced. If it's not stabilized very well, the chance of puncturing major organs increases dramatically. All right, and then flail chest. So the next chest injury is called flail chest. Basically, it's just a very complex rib fracture. What happens is your ribs break in two places. Okay, so the rib is broken here and it's also broken back here, which means this rib is not connected to the other two ends, right? And it happens in more than one place. The reason it becomes very complex and becomes a problem is because it causes a lot of motion, okay? It will cause that chest with every breath and every exhale, it will cause those ribs to push outwards when you breathe out, like this picture shows right here, and then it will cause them to suck in when you breathe in. Every single time those ribs move, it's going to cause a lot of pain. And it's going to make breathing very, very difficult. There will be a lot more movement than just a traditional rib fracture in the area, and you'll be able to see it. There will also be some bruising in the area. But other than that, it's really just the same signs as normal rib fractures, with the exception that the pain is probably going to be really, really high. And this person needs to, well, we'll talk about that on the next slide. The biggest thing about flail chest, you're not going to apply any constrictive bandages around the chest, and you're going to call 911. We need to have further medical care take care of this to help with both the pain and with better stabilization, and it may also, to prevent damage, require some sort of surgical intervention. All right, now we're going to talk about open chest wounds, okay? First type of open chest wound is a sucking chest wound. What you're going to find is this is obviously the skin has been broken, but there's not an object there, so it's just a hole in the chest. Some things to look for: there will be some blood bubbling out of the chest wound because of the air exchange coming from the chest cavity. When the person is breathing in, there will be a sucking sound, hence the name sucking chest wound. Okay. As far as what to do, you want to leave the wound exposed to air. Now, this is a quiz question. Okay. Do not cover it unless you're using direct pressure and a dry gauze to control bleeding. Okay. Bleeding control is the only reason you would cover it. Otherwise, we're going to leave it exposed to air because we do not want to mess with the lungs' ability to function. Okay? If we cover it up, then the pressure of the chest cavity it just becomes all finicky. And it really depends on whether the lung was punctured or not, but we don't know that. So we don't want to cover it unless we have to control bleeding. Okay? And of course, with a sucking chest wound, we're going to call 911. All right. Anytime you have an impaled object in the chest, okay, for one, usually it's pretty easy to tell because you're going to be able to see the object sticking out. As far as what to do for it, we're going to stabilize the object with bulky dressings. So like this picture right here, they just put some bulky dressings around it. You could use a wrap around the torso to hold it in place if it was plausible. In this situation where the person's laying down, it's not really plausible, right? I'm not going to lift them up to get an ace wrap around there. We're just going to hold those dressings in place. And of course, we're going to call 911, okay? Do not, and I repeat, do not remove the object, okay? There are very few exceptions, which we've talked about in previous chapters, that you would remove an impaled object. In the chest, we're not going to remove it, okay? We're going to let the higher-ups and the other medical providers that have more advanced training handle that for us. Okay, abdominal injuries, meaning to which we'll show this on the next slide, but the bottom of the rib margin down to your pelvis, that's your abdomen. The same logic applies to abdominal injuries as chest injuries and all wounds in general. It's either going to be an open or closed, but the difference with the abdomen is now we're worried about other organs, and these organs can either be hollow or solid. And whichever organs may be damaged is going to determine how we treat them. Okay, so a hollow organ, like your stomach or your intestines, they have contents. Okay, if there is a rupture to one of those hollow organs, those contents can spill out into the abdomen, which is damaging to your other structures. Okay, solid organs like your liver or your spleen, if those rupture, they bleed. Okay. So for a closed abdominal injury, again, that occurs when there's some sort of tissue or damage to the underlying tissues in the abdomen, but the skin's not been broken. To examine a closed abdominal injury, all you're going to do is put some light pressure near where their pain is to try to determine what has undergone damage. Okay. Now, to help navigate where the damage is at and what is in the area and could possibly have undergone damage, we use the 4 quadrants system like we talked about early in the semester. So the right upper quadrant, okay, so the things you need to know is what organs are in what quadrant. So your belly button is right here in the center. Then we create a line from the center of your chest down to here, and then right perpendicular to that through the belly button is where we do our other line. So the right upper quadrant is mainly going to house your liver. That's the biggest organ there. And if there's pain in the right upper quadrant, that's one of the first things you're going to think of is the liver. The left upper quadrant houses the majority of your stomach and your spleen. Left lower quadrant really only houses intestines and colon, so no super major organs. Intestinal injuries are fairly rare, most often associated with some sort of illness, less than trauma. Okay. Bottom right quadrant, the biggest one you're going to find is your appendix. If someone has lower right quadrant pain, right lower quadrant, I guess, based on this, appendicitis is something we're going to be very concerned about. Okay. So knowing basic anatomy, where structures are at, those are going to help determine what we're looking for. Okay, some other things to look for. We'll look for bruises and other marks. Obviously pain, tenderness, any sort of muscle tightness or muscle guarding, rigidity. A rigid abdomen, and I mean rigid, like I don't care how rock hard your abs are, a rigid abdomen is going to be hard. That means internal bleeding. Okay, so that's a big problem. That's a reason to call 911 right away. And the other thing is distension. So having like a pot belly could also be a sign of some sort of internal bleeding or some sort of inflammation of specific organs. Okay. As far as how to treat them, put them in a comfortable position. Side lying can be helpful, especially if we're worried about vomiting. With the legs slightly bent to take pressure off of the abdomen. If your legs are stretched out all the way, it pulls your abdominal muscles down and puts pressure on the abdomen. And of course, we're going to call 911 especially if it's a severe sort of trauma with lots and lots of pain. I mentioned it briefly. Um, as far as the appendicitis, you can say it either way: left, right, lower right quadrant, or the right lower quadrant. It's the same idea. Um, the best way to test for appendicitis is to look for what's called rebound pain. So when you put pressure in the right lower quadrant or the lower right quadrant, let me say it either way. When you put the pressure on, it's actually going to feel better, but when you let go, the pain increases significantly. Okay, that's called rebound pain. That is a major sign for appendicitis. The other place is if you go about halfway between your belly button and the top of your rib bone, that's called McBurney's point, and that's where your appendix is at. It's the best way to find your appendix. If the pain is there, then that is often a sign of appendicitis. Appendicitis warrants immediate referral to a hospital. The person needs to be seen. Appendicitis can be deadly if it's not treated correctly. For an open abdominal injury, again, when the skin's been broken, most of the things we're going to see some sort of a stab wound or a penetrating object or a gunshot wound. As far as what to do, it's really the same as an object in the chest. We're going to stabilize it with bulky dressings and try and control bleeding by the bulky dressings around it. Don't put pressure directly on the object. You can put pressure around the object to help control bleeding. We're going to call 911. Do not remove the object. Okay, be aware. Kind of a nasty picture on the next slide. Be prepared for it. For protruding objects, as far as what to do, we're going to keep the person laying down and try and pull their legs up a little bit towards the abdomen. This creates a little bit of a negative pressure to help try and pull the organs back in. And we're going to let gravity help us prevent those organs from coming out further, or the organ from coming out further, and to help pull it back into the abdomen. Okay? Then from there, we're going to cover the organs with a moist, clean dressing, as sterile as possible. Moist because we want to keep those organs from drying out. That can cause the tissue to die. And of course, we're going to call 911. Don't go poking organs back in or try and push them back into the wound. We don't know if they're supposed to go in a specific place or if we're going to cause more damage to other tissues. Let's let the higher-ups handle that. All right. As far as pelvic injuries are very rare, especially pelvic fractures. They require a very, very large amount of force, to create a pelvic fracture. Usually they're caused by motor accidents or a major fall, and they can be very debilitating and most often are going to require surgical intervention. The person's going to have surgery. Anytime somebody has a lot of pain in their pelvic area with any sort of movement, that's something we're going to be concerned about, especially if it was after a major accident. Some other things to look for, again, where the pain's at, that increases pain in that area that increases with movement. If they're unable to stand or walk without significant pain, or if they're going into shock, those would be some big signs of a pelvic injury. Biggest thing about a pelvic injury is it's so painful that it can actually lead to shock just from the sheer pain. And so being aware of that is really important. And then as far as what to do, we're going to call 911. We're not going to move them because of the risk of causing more damage and displacing the fracture or the injury itself. Keep the person lying flat and try and restrict them from moving too much. All right, so that's all for chest, abdominal, and pelvic injuries. If you have any questions, please reach out, and we'll see you later.